Welcome, and today we will discuss about ENT instrument of nose. So now we start with Thudicum's nasal speculum. Okay, so this is the nasal speculum. So the instrument has two flanks. Okay, these are the two flanks. It is routinely used in the OPD to examine the nose. Okay, and this is how the instrument is held. So what's its use? Its use during anterior rhinoscopy, okay, to widen to open up the nasal cavity, offering better view of the structures in the inside of nose. Okay, so other than anterior rhinoscopy, we use it in foreign body removal also for the seeing that where the foreign body is lodged. Then anterior antral washout, nasal packing, polypectomy, and SPM or septoplasty. And we hold it like this in this finger, and this finger is used to press it. Okay, we will see in the next. So this is how we use the nasal speculum. We press it by the middle finger and the thumb base upon the index finger, and we will see. We will examine the nose now. We put the flanks of the nasal speculum inside the nose, holding the head, and now we release the speculum so that it widens the nostril and we can see easily inside the nose what the structures and what is the problem. Next instrument is nasal foreign body hook. Okay, so this is the foreign body hook. It is a handle and this is the hook. Okay, what is its use? To remove foreign body, as its name suggests that nasal foreign body hook, so it's used to remove foreign body from the nose. And this is how the foreign body is removed. The white part is the foreign body, and we go inside the nose and put the hook beyond the foreign body. Okay, put the hook beyond foreign body and pull it like that. Okay, so we pull it the foreign body from the nose by this procedure, by this foreign body remover. So next instrument is the Tilly's forceps. It is the Tilly's forceps, and here is the angle, and this angle is for the instrument does not obstruct the vision of the examiner, and here is the anterior part is not smooth for the holding, for better grip. Okay, and this is the way how it is being held. And what is its use? It mainly it's nasal packing during epistaxis. Okay, and to perform anterior nasal packing, remove foreign body. This is for the holding of the foreign body and crust, etc. We can pull out from the nose, and also remove cartilage and bones of piece during the septoplasty or SMR surgery. Okay, it is also called the Tilly's nasal dressing forceps, and here is also it used in the oral, means in the ear also. The Tilly's forceps in ear and nose are almost same, but sometimes in the for the oral use, the anterior part is the tip is triangular, and for the nasal purpose it is straight. So now we see the use of Tilly's forceps, and how first use is the foreign body removal. Okay, when a smooth object like button is lodged inside the nose, it is very difficult to pull it out by the foreign body removal. It often slips. Okay, so we cannot pull out by the foreign body removal. It slips like that. So in this time we use the forceps to hold the object like that and pull it back, okay, from the nasal cavity. So this is how it is used. And now we will see how the nasal packing is done. Okay, we hold it like this. So this is how the nasal packing is done in the epistaxis or nose bleeding. Okay, and this is the inferior to superior nasal packing. We hold it by the forceps. Okay, at first before that we lubricate the pack first. Okay, So after the lubricating, that its roughness goes to smooth, and after that we use in the nasal packing. At first we use in the inferior to superior nasal packing. We hold the nasal pack like this, and the some part of the nasal packing from the outside to when we pull it back, it is used for the pull it back, and it is how we use in the nasal packing. At first we push and it is pressed, okay, it's pressed, and again we hold the nasal pack. So this is how a nasal pack is done. For by this we can stop the bleeding. And other technique is the anterior posterior technique, okay. So we hold the pack and push inside the posterior side, and it is packed by the anterior posterior pack. So two types of packing, one is inferior superior or other is anterior posterior packing. And next instrument is the Hartmann's forceps, okay. So Hartmann forceps is used to dressing and applying the wick in extra auditory canal, and for the removal of foreign body or a crust from external auditory canal or ear surgery. And it is also used for the nose also. The use of Hartmann's forceps and the Tilly's forceps are almost same, okay. So what is the difference in the structure, okay. It is the Hartmann forceps, the tip is different from the Tilly's forceps. Here tip is straight and here the tip is not straight, okay, it is triangular tip, okay. So mainly the Hartmann's forceps is used for the oral, means ear, and Tilly's forceps is for the nose. The last instrument is PNS mirror or posterior rhinoscopic mirror, okay. So full name is St. Clair Thompson posterior rhinoscopic mirror, but better to say it is posterior rhinoscopic mirror or PNS mirror, okay, posterior nasal side mirror. So this is the mirror, here it is the mirror, and this is the handle, and this handle is bent so that examiner see all the structures without obstruction. And it is also the same thing from the different angle. Here it is the bend, okay, bend according to the mouth structure. So we put it from the mouth, being the tongue depressed, okay. So tongue is depressed and we put it in the mouth. The bend is like that. So that's why the examiner will see all the structures without obstruction, okay, posterior structures. What are the structures we can see by the rhinoscopic mirror? It's the nasal septum, middle concha, inferior concha, soft palate, uvula, and opening of auditory canal. We cannot see the superior concha, okay. What is its use? The posterior rhinoscopy, and to examine the posterior nasal space, okay, after surgery or examination of the posterior space of the nose, okay. So these are the structures we can see from the PNS mirror.